Hi, this is Dr. Reynaldo ROJoson, Director of the ROJoson PEP TalK. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP TalK. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in Medical Management of Skin and Soft Tissue Tumors, Part 1. This is part of the health disorder course. The empowerment objective is for lay people to have an understanding of the fundamentals and generalities in the medical management of skin and soft tissue tumors, Part 1. Part 1 will consist of the following contents. What is a tumor, a soft tissue tumor? What are the different kinds of skin and soft tissue tumors? What are the causes of the skin and soft tissue tumors? And how common are the skin and soft tissue tumors? Part 2, which will be taken up the week after, clinical diagnosis of skin and soft tissue tumors, paraclinical diagnostic procedures, treatment, and prognosis for skin and soft tissue tumors. Definition of terms in the title and the limitation of coverage of my talk. I use the word fundamentals to mean simplest and essential facts and theories which can serve as a basis or foundation and support for advanced information. I use the word generalities to mean general statements of information, not covering specifics and details. Medical management to mean diagnosis and treatment by physicians. What is a skin tumor? A soft tissue tumor. There are 3 keywords to define here: skin, soft tissue, and tumor. The skin is made up of the epidermis and the dermis. The soft tissue is made up of the subcutaneous tissue, which consists of the fat, blood vessels, nerves and connective tissues, and muscles. The bone is not part of the skin and soft tissue group. Skin is the balat in the Filipino language. It is what one sees on the surface of the entire body of a person. Soft tissue refers to the part of the body right underneath the skin, outside of the bone, joint, cartilage, ligament, and cavity that may be under it. More specifically, soft tissue consists of the layer underneath the skin that contains fat, nerves, blood vessels, connective tissues, and muscles. What is a tumor? And what is a tumor of the skin and tumor of the soft tissue? There are a lot of definitions and concepts related to the use of the word tumor that often leads to confusion among the lay people as well as the health professionals. In the Philippines, the following words are commonly used: bukol, bump, mass, lump, nodules, tumor, cyst or cyst in Tagalog, etc. Oftentimes, they may be referring to the same thing, but sometimes not. To simplify things, I recommend focusing on the terms mass or tumor in English and bukol in Tagalog. One can use these 3 terms synonymously to mean the same thing. Don't use the word cyst or cyst unless one is sure of what it means. Cyst is a mass that contains fluid substance. So a tumor is an unusual and abnormal collection of tissues occupying space in any area or part of the human body. It may be of any size or shape. It may be of any consistency. It may be cystic, solid, or complex, meaning a combination of solid and cystic substance. By itself, it can be of any etiology, either cancer or not cancer, until determined by further assessment. Based on the location of the tumor, so a skin tumor is a tumor in and on the skin, in the epidermis and dermis. Soft tissue tumor is a tumor in and on the soft tissue, subcutaneous fat, muscles. Bone tumors are tumor in and on the bone. The tumor has to be differentiated from prominence, induration, swelling of tissues, and enlargement of organs. Prominence of a tissue means it is more protruding than usual, but there is no space occupying mass. Like this, prominent cheekbone. Okay. And then another example will be prominence of the muscles or ribs. Induration of a tissue means it is thicker and harder on palpation than usual, but there is no space occupying mass, like this. So examples of induration of tissues are calluses on the sole of the foot, thickening of a part of the skin due to chronic irritation and inflammation, and scars. Swelling of tissues without an accompanying space-occupying mass is mere swelling. In the absence of an accompanying mass, the swelling may be due to inflammation of the tissue or fluid retention, such as edema of the legs. Note, swelling of tissues may be associated with a space-occupying mass, in which case the focus of evaluation is on the mass. Enlargement of an organ without an accompanying space-occupying mass is mere enlargement. In medical parlance, this is called hypertrophy or hyperplasia. Note, enlargement of an organ may be associated with a space-occupying mass, in which case the focus of evaluation is on the mass. For skin tumors, it has to be differentiated from rashes and unusual discoloration of the skin, like this. Rashes with eruptions and discoloration. Hyperpigmentation and hypopigmentation. So, a skin and soft tissue tumor is an unusual, abnormal collection of tissue occupying the skin and soft tissue, and it is not a prominence, induration, swelling, enlargement, skin rash, or discoloration. Note, an infection of the skin and soft tissue may present as a tumor. Usually the tumor is an abscess, that is, one that contains pus. I will include infections of the skin and soft tissue, okay, presenting with the tumors in the discussions. Let's now go to the next topic. What are the different types of skin and soft tissue tumors? Based on the cells or tissues of origin, okay, skin tumors can arise from basal cells, squamous cells, melanocytes, skin glands, blood vessels, nerves, and connective tissues located on the skin. And soft tissue tumors can arise from the fat tissues, muscular tissues, connective tissues, and blood vessels and nerves. So examples of types of skin and soft tissue tumors arising, or skin tumors arising from skin. Okay. basal cell carcinoma arising from basal cell, squamous cell carcinoma arising from squamous cell, mole and or nevus and melanoma arising from melanocytes, and seborrheic keratosis, seborrheic adenoma. So these are some examples of skin tumors, okay, tumors arising from the skin, or the different types of cells and tissues on the skin. Other examples of skin tumors are hemangioma, lymphangioma arising from the blood vessels and lymphatic vessels, and neurolymphoma from the nerve and in the skin, and fibroma from the connective tissues. Other two examples are epidermal cysts and warts. Fat tumors, example of fat tumors, those arising from the fat cells and tissues, lipoma, liposarcoma, rhabdomyosarcoma, rhabdomyoma, which is a benign type, and rhabdomyosarcoma arising from the muscle, fibroma or fibrosarcoma, and fibrosarcoma arising from the connective tissue, hemangioma and hemangiosarcoma. This is the malignant counterpart arising from blood vessel. Okay. And then those arising from the nerve, neurolymphoma, a benign medical disease, and neurosarcoma, a malignant soft tissue tumors. What are the causes of skin and soft tissue tumors? Basically, these are due to new and uncontrolled growth of cells, okay, usually cancers versus non-cancers, and it can be due to inflammations and infections, especially presenting with abscesses. And of course, the great majority is that we don't know the exact cause of the skin and soft tissue tumors. The causes of the new and uncontrolled growth of cells have been hypothesized to be the following: genetic predisposition, chronic irritation, excessive sunlight exposure, excessive radiations. Others unknown. Inflammation and infections of the skin presenting as abscess or tumors, genetic predisposition, and hygiene dysfunctions. How common are the skin and soft tissue tumors? In general, non-cancers are more common than cancers for skin tumors. More common non-cancer skin tumors are the moles, epidermal cyst, seborrheic keratosis, and warts. More common cancer of the skin, basal cell carcinoma, usually on the face, squamous cell carcinoma, anywhere else. Okay. Melanomas is the least common. So basal, squamous on the scalp, and melanoma. Soft tissue tumors, again, in general, non-cancers are more common than cancers in the soft tissue. The more common non-cancer soft tissue tumors are the lipomas, which is the most common, neurolymphoma, benign soft tissue tumors arising from the nerve, fibromas from the connective tissues, hemangiomas, and lymphangiomas. The more common cancer of the soft tissue are the sarcomas. There are different types: fibrosarcomas, liposarcomas, hemangiosarcomas, etc. Summary and takeaway: I have presented and discussed the following: what is a skin tumor, a soft tissue tumor, what are the different types of skin and soft tissue tumors, what are the causes of skin and soft tissue tumors, and lastly, how common are the skin and soft tissue tumors. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on fundamentals and generalities in the medical management of skin and soft tissue tumors. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of skin and soft tissue tumors. With that, I end my pep talk, Fundamentals and Generalities in Medical Management of Skin and Soft Tissue Tumors, Part 1. I hope I have empowered you, lay people, to have an understanding of the fundamentals and generalities in the medical management of skin and soft tissue tumors. With that, I end my talk. Good day, good afternoon, mabuhay kayong lahat.